A brain that has an insult, whether that is a low blood sugar, a low sodium level, a bad infection, a trauma like a hit on the head, a bleed, a brain can have a seizure when it is under pressure like that. That is called an acute symptomatic seizure. The general thought is that these seizures are likely to stop when the insult has stopped. So, for example, if someone is having a seizure because they've got a very low sodium level, the understanding is when that sodium level is corrected back to a normal range, the seizures will stop as well. In the context of encephalitis, which is an infection that affects the brain tissue, the brain is inflamed and swollen, and at that time, a seizure can happen because there's an acute insult happening to the brain. Later, what can happen is that brain infection can actually cause scar tissue on the brain. That scar tissue persists, and well after the infection has been cleared, that scar tissue will be there. And in the future, months or years down the track, people can actually start developing epilepsy around that scar tissue because that's an abnormality on the brain. So in that way, a brain infection can cause both the acute symptomatic seizure at the very time of the infection, but later down the track can, because of the scarring, lead to developing epilepsy.